Welcome back. September is Atrial Fibrillation Month, also called AFib. Here to talk more about this and what to look out for in your heart health is Jupiter Medical Center's Dr. David Wiseman. Thank you so much for joining us. We were talking earlier about how, you see those commercials for AFib medications a lot. That's how I identified with it. But if you can just explain people what exactly AFib is for us.
Yeah, so atrial fibrillation is one of the most common heart rhythm disorders that we see in the United States, affecting many millions of Americans. It's an irregular heart rhythm that affects the upper chambers of the heart, and when that happens, the heart can race and cause a lot of symptoms like chest pain, shortness of breath, feelings of dizziness, and lightheadedness. And even worse is that it can cause stroke.
And tell us who was most affected here. We were chatting earlier about how older adults are obviously at more risk of developing this, but you talked also about some athletes. Talk about that.
Yeah, that's right. So generally we think of AFib as an older person's arrhythmia. If you're over the age of 65, have things like high blood pressure, diabetes, maybe have had a heart attack or even heart failure, you're at risk for having atrial fibrillation. But we also, interestingly enough, see this in our athletes. Endurance athletes or elite level athletes can develop atrial fibrillation, and although we don't completely understand it, we think it has something to do with our autonomic nervous system.
Interesting. And how can people know if they have this condition? I mean, your heart speeding up while you're working out isn't unnecessary. It happens. So how do you know? How do you know when to get treated or checked?
Right. So I think the rule is that if you're exercising and you're appropriately doing something that your heart rate's supposed to be fast for, then that's a normal thing, right? But let's say you're just sitting there at the dinner table and all of a sudden you start getting short of breath and your heart rate is abnormally fast. Well, that's something probably you need to go get checked out for. Many people end up going to the emergency room or seeing their primary care physician first.
Should older adults just make this a part of regular checkup for them, or is it when they start noticing it as well?
Yeah, well, I think both, right? I think you have to be keenly aware of your body, and also when you feel bad, go see your physician. And typically they'll do something called an electrocardiogram, which is an electrical picture of the heart, and that'll diagnose the problem.
Is there anything viewers at home can do on a daily basis to just prevent this from happening in their everyday life?
Right, well, there's so many things that we can't do, but the things that we can is obviously live a good, healthy lifestyle. Some light to moderate exercise is always good on a regular basis, avoiding excess alcohol, smoking, making sure you control your risk factors like high blood pressure and diabetes.
Yeah, and all of these prevention tips right now on your screen. So if you want to take a picture of it so you remember it, just make sure you do that right now. Good information there. Anything else that you would like to add about this condition? With this being an awareness month, is there anything people can take away from you being here?
Well, the great thing actually is that we have really amazing treatments that have come about over the last couple of years. First of all, we have, in addition to medications, minimally invasive treatments like catheter ablation. These are minimally invasive procedures where we can insert special catheters into the heart and actually correct the arrhythmia and get people off medications. People also with atrial fibrillation are at risk for stroke and often recommended blood thinners if they're at higher risk. We now have alternative options which we can implant devices inside the heart and get people off those blood thinners if appropriate.
Okay, so a lot of advancements in treatment there. And I know just researching from Jupiter Medical's website, you have a lot of information on there as well if people just want to learn more about AFib and the condition, what it is, and how it acts. So thank you so much for being here. And again, to learn more about this disease and learn more about Jupiter Medical Center and their work, just go to our website. You can just type in AFib, and we have a web article up there right now for you. Sandra?
Alrighty, thanks so much, Steve.